This particular abstract is being presented by one of our fellows, Dr. Senthil Bhupalan. And what Senthil did was he looked at all the patients who have received transplantation for Dyskeratosis congenita, a bone marrow failure syndrome at our institution. It's interesting, this particular condition, even though bone marrow failure is why these patients present to us as hematologists or transplanters, they actually have multiple systems involved because of the telomere biology disorder that they have. And so one of the problems that the transplant community has seen with respect to transplantation for Dyskeratosis congenita is that these patients have a very high rate of toxicity, especially pulmonary toxicity. And so for that reason, drugs such as busulfan or total body irradiation are usually avoided for these patients. In our cohort, we had a series of patients who received a reduced intensity based conditioning based transplant for patients with Dyskeratosis congenita. And so we have a fairly long follow-up, which is reported in this abstract. And we have shown that with this reduced intensity conditioning based transplantation, these patients have actually continued to do remarkably well with preserved pulmonary function. And that was the main message that we wanted to get across, that reduced intensity conditioning based transplantation is not only safe, but actually quite effective and does not lead to significant pulmonary toxicity, which is one of the main complications post-transplant seen in these patients.